pregnant individuals are at higher risk of getting severely sick with COVID-19 in terms of requiring an ICU stay or mechanical ventilation.
Pregnant healthcare workers now have access to the COVID-19 vaccine and can get the shot if they want it. This comes following updated national and provincial guidelines after this high-risk population was initially excluded from getting the shot because they weren't included in the clinical trials.
There was a cascade of sort of like confusion about what to do with this special population.
There's currently no safety data when it comes to pregnant individuals and the vaccines.
It's not a live vaccine. It doesn't influence or communicate whatsoever with the person's DNA, potentially impacting the fetus. We know that vaccines in general are safe in pregnancy. So there's really no theoretical science-based reasons why these vaccines wouldn't be safe. That being said, it just hasn't been studied.
But new guidelines mean Ontario's healthcare workers on the front lines of the pandemic now have access to the shots. That includes staff working in hospitals and long-term care homes hit hard by the virus.
Many hospitals, even before the province amended their guideline, actually realized this is an issue for so many of our healthcare workers, where the majority are women. They need to be given the choice, especially given the recent information that pregnant individuals are at higher risk of severe illness with COVID-19.
The Ministry of Health says its approach to the vaccine is based on the expert recommendations of the National Advisory Committee on Immunization, which also recently updated its guidelines for the high-risk group.
There were several pregnant individuals within one day who received the vaccine and were really receptive and appreciative, first of all, of obviously been given the choice to be vaccinated, but also the information and the support around it.
Hospitals in Toronto complied with the directive, including Scarborough Health Network, Michael Garron Hospital, Sinai Health, University Health Network, and Unity Health. Dr. Bogler says hospitals outside Toronto and Ontario have also reached out to her,
who have requested that I send them the consent form that we created so that they could show it to their hospital, hoping that their hospital would be receptive to change. So there are many places still that are not vaccinating pregnant individuals.
In a release on the Moderna vaccine on Tuesday, the World Health Organization put forward a number of recommendations, among them this. While pregnancy puts women at higher risk of severe COVID-19, the use of this vaccine in pregnant women is currently not recommended unless they are at risk of high exposure, such as health workers. In Ontario, pregnant healthcare workers in some cases would be required to sign a consent form and consult a healthcare provider about the risks and benefits before getting immunized.
They should be supported whether they choose to receive the vaccine or not. And if they don't choose to receive the vaccine, based on the fact that we don't have safety data yet, and they're just worried